Mr. Welch is recognized.
Thank you very much, Mr. Chairman. It's wonderful to be here in the Rules Committee. You know, I want to acknowledge all of you, but especially you. Your team campaigned very effectively. Now the challenge is whether you can govern responsibly. And this decision that this Rules Committee makes is going to set the template for the entire 112th Congress. And the questions before you were basically three. The first question is whether on the promise of fiscal responsibility and implementation of the cut-go rule that is replacing our pay-go rule, you'll apply that when the evidence from the impartial referee is that repeal, your proposal for health care, will add $230 billion to the deficit. And from where I sit, the promises that you have made impel you to come up with an offset for that $230 billion. Second, you've made promises after criticizing the way our Congress was run, that there will be open rules, that there'll be an allowance for debate on important questions. There is no more important question, more intimate to the American people, than how their health care will be delivered and how they'll have access to that health care. And we are seeking, all of us, and the amendment I'm going to propose is co-sponsored by 65 of my colleagues, and 65 of us have co-sponsored Ms. Castor's amendment, Mr. Murphy's, Schakowsky's, Ms. Eschew's. We are going to ask for the opportunity for a yes or no vote, up or down. Now, I listened to Mr. Woodall and followed your campaign some, and I know everything you said, you had the backing, obviously, of your people. But I campaign too, and the people I represent want me to defend some of the provisions that are helping the middle class in this legislation. And I believe that my constituents, as your constituents, are entitled to know where you stand, where I stand, and the way we tell them, the way we're accountable, is that when the roll is called on the specific question about repealing access to health care for people up to age 26, about taking away the lifetime caps, that if you have one opinion and I have another opinion, we state that publicly by our vote, and then our voters are allowed to decide whether they agree with you or they agree with me. And that's the way it should work. But this is the first opportunity for you to follow through and allow us to be accountable to our constituents. The third question is this: is the first bill passed by the Republican Congress on health care going to take away some specific, hard-fought achievements for the middle class of America? And a number of the amendments you're hearing, this is not about political rhetoric. It's about the reality of policy that affects real people, as you've heard, real families and real businesses. And please understand, you've made criticisms. Some of your criticisms, I think many of us at this table agree with. We do know that this has to be a work in progress. This is a multi-trillion-dollar challenge for this country. So anyone who says that we have to improve this, you have all of us at this table in agreement with you and hoping somehow, some way, we can find a way to work together to improve it. But why would we, in the quest to improve it, destroy things that are now actively making a difference for people and they're depending on it? I'm going to talk about preventive care. I got off the phone this morning with Tom Eubner, who is the CEO of the Rutland Community Regional Medical Center. And I said, Mr. Eubner, what does it mean to you? And he was a close call on whether he wanted this bill to pass. He was one of my local hospital folks. I paid a lot of attention to him because he was in the real world, not the abstract world of what this policy was. And I said, what is the implication to you and to the work you're doing, your hospital, if we repeal the access to free preventive care? And what he said, and I'm going to quote, if we are serious about bending the cost curve, We need to prevent disease, and we need to manage disease, and we have to have free preventive care in order to do that. People come into that facility with breast cancer because they couldn't afford to get a screening in time. People come in with advanced diabetes because they couldn't get a simple test. Now, you know this as much as I know this. I'm not telling you anything you're not aware of, but what this Congress did last year is we passed legislation that give our citizens the right to get that test. And why? With all of the disagreements among us, with all of the different people that we represent, why would we take away from Tom Eubner and the Rutland Regional Medical Center this tool that they need to make our folks healthy? I spoke to Dr. Neil Hyman, the UVM University of Vermont College of Medicine. He told me that colon cancer screenings are absolutely essential to early detection of cancer. Again, I'm not telling you anything you don't know, but just this week, he saw a 64-year-old patient who could not afford to receive regular screenings. By the way, those are free to him now. Like many others, he was waiting to qualify for Medicare. 64, he needed another year. He waited too long. Now, instead of catching that disease in its early stages, this Vermonter is suffering from metastatic colon cancer. This is real. The decision that you are making is real. This is not campaign rhetoric. You know, you won the campaign, and you were effective in your arguments, but you're making a real decision. You are part of the United States Congress, and the policies that we make are not about campaign rhetoric. It's not about the next election. It's about what's going to happen to the Rutland Regional Medical Center. What's going to happen to this Vermonter who now has metastatic cancer, colon cancer that could have been detected. There are simple things in this bill that are important to the people you represent and important to the people I represent, and it is absolutely unnecessary to take those securities away from the middle class of this country. Thank you.